everyone, welcome back again. As we were started discussing earlier, the uses and advantages and benefits of doing CT scanning. In this section, we are actually having a practical demonstration and a first-hand view of what exactly a CT scan machine is and how does it operate and how the technician will go about performing a CT scan. So in this section, we are actually going to have a real patient who is going to be doing a CT scan of his brain, and the technician is going to conduct the CT scan, and we will show parts of it so that you all will understand exactly how the procedure is done. I choose to do this part simply because when patients hear that they have to perform a CT scan, a lot of times patients get very scared and they are frightened about going into this big donut. They're wondering what this donut is about. They're afraid of going into the donut, and they're afraid of being scared of perhaps sometimes some patients may have claustrophobia and they're afraid of going into these things. So I will try to explain to you that it is not something to be afraid of, and it's generally a very safe and simple procedure. So I'll just take you through to the parts of the CT scan. This part that you're looking on at first here is known as the gantry. It's what we call a big donut generally in common language, and you can see it resembles a donut. It has a space here. This is where the patient body goes into in order to get the CT scan done. And as I explained before, a CT scan is a sophisticated X-ray machine in which X-ray pictures are taken in slices. So you are going to be taking very thin slices of the structure. Let's say if you're doing a CT scan of your brain, the patient head will go into the opening of the CT scan donut or the gantry, and very thin slices of X-rays will be taken, sometimes 2 millimeters, and it can go up to sometimes 5 millimeters, depending on what are the specifications and what the radiographer or radiologist is looking for. And these radiations, these X-ray pictures are now transferred to the control room where pictures will be put together and sent to the radiologist for interpretation. So in the gantry, this is where the X-ray tube is located. The X-ray tube is located in the gantry, and you also have certain detectors located in the gantry. If you look here on this side, this is a what we call an emergency power knob. If there is a problem that is taking place, or if while the CT scan is taking place, the operator needs to turn off the machine immediately, he can simply just press this power knob and turn off the machine directly. These are all the control buttons on the side here, and this is the emergency power knob as I mentioned before. So it's a very simple unit, and I would just like to let all the patients know, everyone looking on Facebook, that there is no need to be afraid. If your doctor recommends a CT scan, there is no need to be afraid. It's just your body is going into the aperture or this open area of the gantry. The second part I like to mention is the table. This table is a automatic controlled table which can go in different directions, up to the side, backward and forward. The operator will control the table, so the patient will lie on the table right here. Depending on which part of the body is going in, the patient lies with the head up on the side, and this is because it's an automatically controlled table. The controller or the radiographer or the CT technician would then control the table to send it into the gantry to get the CTs. The other part is known as the power supply, the power transformer, which is right on the side here. This unit right here, all the power supply is collated with this machine here, which then transfers the images from the gantry into the control room. So this is the third component of the CT scan. And then I'm going to go now to the operator's room, where we will see the console, and the console is where we will see where the CT technician will then now collect all the images, put it onto the computer, and from there he would use the computer to create three-dimensional pictures, which would be then sent to the radiologist, who will then interpret and make the proper diagnosis. So come take a walk with me now to go into the console. Known as the operator's room, it is where the CT technician will be located while the CT scan is being performed. And as you can see, it is a radiation protected room. It is very thick walls, as well as a leaded glass where he can see through the control room, see the patient, but no radiation can enter this room to cause any problems to the person conducting the CT. This is the leaded glass here, as I said before. Now the control room has various components, but the main component is to note the console. The console is where this is the entire console is made up of this computer. You will have the keyboards and the different monitors. All right. When the images come to the computer, the images are now collated, is transferred, and then it is then reorganized into three-dimensional pictures. This is what makes the CT scanning machine such a sophisticated machine. It was invented to help the doctors to make more accurate and faster diagnosis of different problems in order to treat patients very quickly. So these are some of the pictures, and if you look here, right here, a CT scan of the brain was done a few minutes ago, and this is one slice, one image of CT scan of the brain. As you can see, the orbits of the eye, the sinuses, the nasal bone there. This is the skull to the back, and this is the cerebral tissue here, the brain. This is a little part of this brain stem curve going down there. All right. So as I'm finishing here now, I will just ask the CT technician to just demonstrate. He's going to be conducting a scan of a patient, a real scan of a patient's brain. He fell down and hit his head, and this patient may have a bleed, an internal bleed, or a fracture, and this is the most accurate test to diagnose these problems. This test is going to be done in right after now, as soon as I'm finished speaking to you. So I'll take you back outside, out to the gantry where the test is going to be conducted, and I'll just demonstrate again very quickly how the test will be conducted together with the CT technician. So that's in 1 minute. We will continue again. Thank you. So here we have our CT technician is organizing with the patient, preparing the patient for the scan, and he is on the bed at the moment and getting proper positioning using the control. And as you can see, the bed is movable, automatic. The bed is now gone into the aperture of the gantry, and proper positioning. If you look right across here, this is a automatic injector. This is used to inject dye, as I mentioned in the first part, where patients who have to get CT scan with contrast, we will use this injector to inject the dye before the scan is done. Alright, and the patient is in position, and as I was explaining before, patients should not be afraid of doing a CT scan because of this machine and this large donut that they have to enter. It is not something to be afraid of. It is simply the process that is involved, where you have to go into the gantry in order for the X-rays to be taken from the gantry. Alright, so the operator will now have to, all of us will now have to exit this room in order for the scan to be performed, because there's we should not be exposed to any of these radiation while the test is being done. Alright, so we just go back into the operator's room where we will meet our CT technician and see him perform the CT scan. And the scan is being performed. It's a very quick test. It only takes a few seconds to be completed, and the test is being performed by the technician. As he does the test, the images will show up on the monitors, and you will see some of the pictures showing up on the monitors. Right across here, there are so many pictures. Usually hundreds of pictures can be taken, and these pictures are now will then be used to show three-dimensional images in order to make a proper diagnosis. In this case, the patient, you can see from some of the images that the patient did not sustain any fractures from his fall. His skull is very well intact, and we'll have to look at the brain tissues to see if there is any bleeding. Finish with the CT scan. I'd like to thank everyone for viewing and viewing this video today. It has been a very enlightening experience for me to show you all how a CT scan is performed, the advantages of doing a CT scan, as well as the uses of CT scanning. Alright, we'll just take a walk back outside and see if the patient is okay, and make sure that he find out if he had any, what was his experience with the CT scanning. Let's take a look to show the cases.
Okay, so we're all finished, right?
Very well, the scan has been completed and the patient has now been removed from the gantry area and is now coming off the table. I just wanted to ask you, just for our patients who are looking on Facebook, how was the experience? Were you afraid? Was it frightening for you?
It was really fantastic.
Oh, very good. I must say that you have good news. There was no fractures.
That's really excellent. It was really great.
Very good, very good. Okay, so
Thank you so very much.
Excellent. Well, have a good day. Okay, excellent. Thank you very much. Okay, bye, everyone.